President Biden's plan to ease pandemic restrictions at the Mexican border. The ruling states the order that denies migrants the ability to request asylum under U.S. and international law will continue. So far, nearly 2 million migrants have been expelled under Title 42. This was a Trump-era order put in place in 2020 to help stop the spread of COVID. The Department of Justice says it will appeal, and the White House released a statement tonight, and it reads in part, the authority to set public health policy nationally should rest with the Centers for Disease Control, not with a single district court. However, in compliance with the court's injunction, the Biden administration will continue to enforce the CDC's 2020 Title 42 Public Health Authority pending the appeal. The investigation into mysterious hepatitis cases in children goes on, and now another child has died from the severe liver illness.
WGN's Shannon Halligan is joining us now from the newsroom with the very latest. Shannon.
The Centers for Disease Control and Prevention reporting today a sixth child has died. Researchers are still on the hunt for the cause of these clusters. Over the past 7 months, 36 states, including Illinois, have reported unusual cases of hepatitis impacting children. The cause remains unknown. Dr. Tina Tan, a pediatric infectious diseases physician at Lurie Children's Hospital, said it's who is getting sick that's unusual.
These cases of hepatitis occurred in clusters, and they occurred in normal, healthy children with no underlying conditions. But to put that in perspective, worldwide, there have only been about 450 cases that have been under investigation or identified. So this still remains a fairly rare event.
The Centers for Disease Control and Prevention is now investigating 180 cases of hepatitis in children in the U.S. That's up from 109 on May 5th. However, the Public Health Agency said in a statement that not all of these cases are new.
The CDC is still investigating all the cases that are being reported. Now, some of them are not related to this, but, they're doing their due diligence at looking at all the cases that have been reported.
Dr. Tan said that while this remains rare, it is important for caregivers to be aware of the symptoms of hepatitis. In particular, jaundice. As
the infection or as the inflammation gets worse, you can also see dark urine, you can see light-colored stools, and you can see yellowing of the skin and yellowing of the whites of the eyes.
The CDC said adenovirus has been detected in nearly half of the children, but further laboratory tests need to be conducted. If a child exhibits any signs of hepatitis, caregivers are encouraged to contact their healthcare provider. Live in the newsroom, Shannon Halligan, WGN News.
Thank you, Shannon. I'll take it from you.